Here we have an example of the effect of the economic transformation and the effect that we see on the disease context. This area had been traditionally flooded until the road was built and the water managed to go away from the fields. This all would have been planted in teff. It's a local, very, very small grain, highly productive in terms of the economic value, but it was suited to this area because it likes wet soil. But the incentive of maize is the production level, the yield is so high that farmers are drawn to it, and when the water began to recede because of the activities of the road building, they were able to plant maize, get a huge production, 7 to 9 tons per hectare, and so we see the effect on the landscape of more and more maize being put in areas that used to be teff. This was teff last year, this was maize last year, and the farmers will replant, calculating both the changes in the land, the ecology, which then affect the ecology of the mosquito, the ecology of malaria. Maize produces an accelerant. Maize pollen makes the larvae of the mosquitoes grow faster, live longer, and potentially add much more dangers to the level of transmission of malaria. That's our study. But you see, part of this is the ecology of the landscape itself, with economic factors, with factors of new varieties of plants, of crops available. All those things together give us a new kind of landscape. Over 5 years we've been here, we see the transformation. Project that back and project that forward, and we have a whole new set of factors that will affect what is the health of the people living here. How do we think about that health? It's an ecological problem. It's not a problem of biomedicine. It's not distributing vaccines. We don't have vaccines yet. We're unlikely to get them. And what we have is a situation where we have to sort of see this moving target and respond to it by advice, working with farmers, by providing appropriate health facilities and working with local communities. And that's what lies behind the project that we've been doing over the last 5 years, and hope to continue to contribute in our interactions with local folks here. Hey!